Are you one of the many Americans who suffers from anxiety, depression, or other mental illnesses? Are you tired of taking a pill that temporarily relieves your symptoms but comes with a host of side effects? If so, then psilocybin therapy may be the answer you are looking for. Today, I'll be persuading you that psilocybin therapy should be legalized and used to treat depression and other mental health issues based on the experience that I have had and the research I have done. In persuading my audience that psilocybin therapy should be legalized to treat depression and other mental health issues, I will discuss the following: the state of mental health in the United States, the side effects of both psychiatric medicine and psilocybin, and finally, what psilocybin is and why psilocybin therapy should be legalized. First, I'll discuss the state of mental health in the United States. According to the article titled "The State of Mental Health in America," accessed on December 7, 2022, and published on the website mhanational.org, over 50 million adults in the United States deal with some sort of mental illness. I know many people who suffer from depression, anxiety, or other mental health issues, including myself. Oftentimes, mental illness can make you feel helpless and lost, even when you're on medication. According to the article titled "About Mental Health," retrieved on December 7, 2022, and published on cdc.gov, some of the causes of mental illness include early adverse life experiences such as trauma or a history of abuse, experiences related to other ongoing medical conditions such as cancer or diabetes, biological factors or chemical imbalances in the brain, the use of alcohol or drugs, and having feelings of loneliness or isolation. Mental illness is often unavoidable, and it's not the individual's fault. There are many different methods that can be used to treat and manage mental illness, including the use of psilocybin therapy. Now that I have discussed the state of mental health in the United States, I will discuss the effects of commonly prescribed psychiatric medication and the side effects of psilocybin. Second, I will discuss the side effects of both psychiatric medications and psilocybin. According to the article titled "Common Side Effects of Psychiatric Medications," written by Dr. Michael Dimitri and published May 17, 2016 on Psych Central, some side effects of depression medication include nausea, diarrhea, sexual dysfunction, insomnia, and fatigue. Dr. Michael Dimitri also writes that medications commonly prescribed for anxiety can cause drowsiness, impaired coordination, memory impairment, and dry mouth. Having taken both antidepressant and anti-anxiety medications, they do help with the symptoms, but the side effects can get in the way of living a normal life. When I took anti-anxiety medication for several years, it was as if I was on autopilot. I felt almost no emotion and could only function if I had taken my medication. Yeah, the anxiety was gone, but it was as if I was just a shell of the person I used to be. Although medication may work for some people, the side effects that I experienced were debilitating. I ultimately decided to stop taking medication and seek alternative treatments. In a clinical trial titled "Effects of Psilocybin-Assisted Therapy on Major Depressive Disorder," a randomized clinical trial held by JAMA Psychiatry and conducted by Alan K. Davis, Frederick S. Barrett, and others, there were no serious adverse effects after participants were administered psilocybin, and at least one half of the psilocybin sessions included challenging emotional, fear and sadness, and physical, feeling body shakes or tremble experiences. The thing about these side effects is that they are not long-lasting. Once the psilocybin's effects wear off, the side effects also disappear. Now that we have learned about the mental state of the United States and the various effects of psychiatric medicine and psilocybin, it is time to discuss what psilocybin is and why it is an effective way to treat depression and other mental illnesses. Last but not least, I will explain what psilocybin is and why psilocybin therapy should be legalized and used to treat depression and other mental illnesses. According to webpage Psilocybin Definition and Meaning, retrieved on December 7, 2022 on dictionary.com, psilocybin is a hallucinogenic crystalline solid obtained from the mushroom Psilocybin mexicana. Psilocybin mushrooms can be found naturally in the wild or grown under controlled conditions. Many people use psilocybin recreationally to trip, but it can be extremely useful in controlled environments in treating depression and other mental illnesses. According to an article titled Psilocybin Treatment for Major Depression Effective for Up to a Year for Most Patients, study shows, published on February 15, 2022 on hopkinsmedicine.org. Researchers of a study reported that psilocybin treatment in both groups of participants produced large decreases in depression, and that depression severity remained low 1, 3, 6, and 12 months after treatment. Oliver Lee McCabe III, the founding director of the Johns Hopkins Center for Psychedelic and Consciousness Research, also stated, compared to standard antidepressants, which must be taken for long stretches of time, psilocybin has the potential to enduringly relieve the symptoms of depression with 1 or 2 treatments. For people who experience negative side effects while taking prescription psychiatric medicine, such as myself, the thought of only having to take a dose or 2 of psilocybin a year may sound appealing. Rather than taking a pill daily and putting up with the side effects that often come with prescription psychiatric medication, a dose or 2 of psilocybin paired with a session of psychotherapy can dramatically improve symptoms of depression. According to article Colorado Just Legalized Magic Mushrooms, an idea that's growing nationwide, written by Danica Jeffries and published November 12, 2022 on CNBC.com. Colorado citizens voted to allow the use of psilocybin at state-regulated centers under the supervision of licensed facilitators. The passing of this initiative by Colorado is a step in the right direction for the future of psilocybin therapy. Hopefully soon, people can choose to receive psilocybin therapy rather than taking medication. My purpose today has been to persuade you that psilocybin therapy should be legalized to treat depression and other mental illnesses. In doing so, I have discussed the state of mental health in the United States, the side effects of both commonly prescribed psychiatric medications and psilocybin, and what psilocybin is and why psilocybin therapy is an effective way to treat mental illness. Psilocybin therapy is an extremely effective way to alleviate symptoms of depression and other mental illnesses that many Americans face daily. Although magic mushrooms have been demonized for quite some time, psilocybin therapy has the potential to help countless people get a hold of their lives once again. Thank you for listening.